with that, some schools in San Diego are about to reopen. Many of them have already started. And so it's now time to talk about some ways to stay healthy, what you need to keep in mind as you're heading kids back to school, even if they're going virtually. So here with more, we want to introduce and say good morning to Dr. Abby Olalade from the Sharp Reese Steely. Good morning, doctor. How are you?
Good morning, Liz. Thanks for having me. I'm great. Thank you.
So this is interesting because, you know, right now, I think parents, and I speak for myself and some of my parent friends, many of us have not gone or taken our kids to their annual checkups, which were maybe perhaps in the summer because of COVID-19 and whatnot. So number one, have we made a mistake in not keeping those appointments?
Well, you know, I understand, you know, that at the time there was a lot of fear and a lot of worry because COVID was, you know, really spreading. But it is important to try to actually call to make those appointments because we are open and, you know, the other healthcare systems are also open. So it's important to make sure that you get your flu shot and also that kids stay up to date on their immunizations. That's completely crucial.
Yeah. OK, so no longer put it off. If you're one of those parents who have put it off, go and take your child to his or her doctor. Now, you mentioned the flu shot, and I want to delve into that right now because, you know, here we are dealing with the coronavirus pandemic, and the flu shot, as we know, is just about here. And I think we talked about this a little bit a couple of weeks ago. This is something that you suggest definitely get the flu shot for your child sooner rather than later?
Absolutely, yeah. So we are heading into flu season, and the fact that we have this in addition to an ongoing coronavirus pandemic, you know, everyone should remember that it's very important to get your flu vaccination, and especially in children as they go back to school, because although they're not immune to the effects of coronavirus infection, they are very, very much affected by flu and have a higher risk of getting severely ill if they get flu. So it's important that you take them in to get their flu vaccinations. And this applies to adults as well. Everyone 6 months of age and older should get a flu vaccine.
Okay. And just in terms of overall general health, doctor, you know, over the past 5.5 months, we've talked and done stories about how so many of us adults have packed on the pounds, right? Because we have not been very active, the COVID-15 or COVID-19, if you've gained 19 pounds. But the same can be said for kids. A lot of them may have been very inactive, and with that, you know, we got to start thinking of the weight gain that our kids have experienced. Is that true?
Very true, and a really, really good point. You know, obesity was already epidemic. You know, there is a very, very high percentage of obesity, and it's so important that we start to remind our kids that they need to become active, watching the diet, and, you know, even anecdotally, I've seen it in my own patients. You know, understandably, we've been at home, and the fact that, you know, we haven't necessarily been able to exercise as much as we would is contributing to this. Some people are eating out of boredom, or they may be drinking too much. So it's important that you not get scared of weighing yourself. It's good to regularly weigh yourself and not have, you know, shame about it, which I know a lot of people do have. You shouldn't. It's really about your health, and now taking those steps that will help you get back on track.
Yeah, you know, doctor, if I came in with my kids and you were assessing my kids and I said, you know, well, doctor, it's, you know, they're sitting and they're playing electronics because they don't have sports right now to go to. And then, you know, they're going to be doing distance learning. What can I do? Would you say don't make excuses, just get out and, you know, run, jog, take the ball out, make that effort?
Absolutely, yes. You know, riding a bike, watching what they're eating, and also participating as a family, which we know does help kids when it's a group effort in the family. There's other things that you can do. You can go outside and throw a ball with your kids. Making sure that they're getting exercise is important, both for their physical and mental health. So little steps every day, you know, contribute to a lot, and it can seem daunting, but it's important to start today.
Is there anything that I'm missing, Doctor, that you'd like to just emphasize to San Diegans this morning as it relates to, staying safe and healthy as kids go back to school or start school?
I think it's important to let them know that it may be different. There might be a change, and to continue to check in with your kids. And trying to keep them in a routine, even at home, is important. And letting them know that, wearing a mask, watching their distance at school, not sharing things as much as possible is going to be important to continue to keep these levels of infection down so we can continue, these reopening measures. So talking with them, continuing to communicate with them is going to be very important.
All right. Well, Dr. Abby Olalade, she is with family medicine at Sharp Reese Steely. Thank you so much for shedding some light and encouraging us as parents to stay on top of our kids as they start school. Here we are. 'Tis the season. Thank you.